Welcome back. We're joined both with these two doctors. Thank you for staying on with us. But we're also joined live from the Bassett Healthcare Network in Cooperstown by Dr. Stephen Hennigan, Chief Clinical Officer for the Bassett Healthcare Network. Doctor, thank you for joining us.
Thank you very much for inviting me.
And first of all, Doctor, for you, a unique challenge for your area is how rural it is in some places. What are your recommendations for those in rural areas on staying safe and, if need be, getting tested?
So our rural community is distant from many healthcare areas and other food and other community resources. So it is a challenge for our community. Bassett Healthcare Network has 50 clinics over a geography of about 5,000 square miles, which is equal to the state of Connecticut. And so we've really kind of developed an integrated system to provide a standard care over that geography. And fortunately, it has forced us to develop technologies such as telemedicine and video visits that has helped us really in the management of this pandemic.
And what process do you have in place for having those healthcare services delivered to them if necessary?
So we have, as the other doctors have mentioned, we really want to make sure that people aren't just arriving to our facilities, emergency room, hospitals, or clinics. And so what we've provided is a telephone number at 607-547-5555 that we're having our community, as well as our Bassett patients, call up the line. And they are given general information, information generated largely by the CDC and the Department of Health, but also, if appropriate, get triaged to one of our nurses who are learned in a protocol to ask certain questions. And if appropriate, that phone call is generated to our practitioner list, and we will actually have one of our practitioners call up the patient at home, have them describe their symptoms, we'll evaluate them, many times just reassure them that they're really not that high a risk. Other times we are asking them to come in to be evaluated and tested. Currently we are testing somewhere about 50 patients a day. We're evaluating, today we evaluated in this line over 600 patients called up our line for advice, treatment, and we've had various different levels of requirements. Sometimes it's just advice, sometimes it's recommendations, sometimes we bring them in. We bring them into sites that are covered but outdoors, which protect our patients as well as our staff. If appropriate, we do tests, we do follow-up. Many of our follow-up for these patients coming in is by video or telephone, for allowing them not to have to drive back to one of our facilities. And we're able to manage them in their home as per the recommendation of the CDC.
Now, one question I have for really all three of you, you two here and then you remotely, and we'll start with you remotely and then go here into the studio, but one issue that hasn't been talked about is how COVID-19 concerns are affecting blood donations. In many cases, some surgeries or emergency work does not stop even when donations are running low. So have you there seen a significant decline in your average donations? Is there an issue there, and are there any other shortages that you're experiencing?
We have been notified by the Red Cross that they are seeing less participation in blood drives. Blood drives generally bring people together, so I think it is a challenge for the Red Cross. We anticipate that that could produce some blood shortages in the time coming down in the next month or two. Right now we do not have any shortages in blood supply, but the Red Cross has notified us that there are challenges, just like with all other gatherings, that people are asked not to come together, and it's we have to kind of design a new way for blood donations to protect the individuals giving blood, and I would say even here at Bassett, that's a process that we're developing right now.
And have you two, Dr. Ken Hall, Dr. Andrew Bushnell, joined us here in the studio. Have you experienced any shortages, or have you been informed about that shortage as well?
Go ahead, Ken.
So we have not yet seen any shortages. However, we know that that is a real possibility. And so we have very strongly encouraged our physicians to be very judicious in their use and to be sure that they're following the appropriate guidelines for the use of any kind of blood products. We also know that people may not be going to do to be giving blood products, and that's also a concern that we have that we're going to be watching very closely.
We've talked about moving our blood drive outside of the hospital itself so that the donors aren't bringing into the hospital COVID-19. Donating blood is an essential service for the community. We cannot exist in an organization without the ability to reach Red Cross blood.
Well, thank you to Dr. Hannigan for joining us remotely. Thank you to Drs. Hall and Bushnell for joining us in the studio. We'll have more with County Executive Anthony Pacenti when we return.